So today the medicine list are this one: Sabina, Sambucus, Sanguinaria, Sanicula, and Sarsaparilla. Out of this, something we would have given clinically would be more, uh, except Sanicula. Sanicula I have not prescribed. All the other medicines, some of the other conditions I have prescribed. Though I don't remember what was the end result, but I have given those medicines. And clinically, more we give this medicine also. So the learning outcome and starting with Sabina. So do anyone of you remember what is the important feature of Sabina?
Hemorrhage and with
Yes.
clots.
Yes.
Also, another one is the pain from the lumbar region all the way extend to pubis.
Yes.
These
And
two, I only these two.
you had any experience with that symptom, Rini?
Yes, yes. I have friend who has the non-stop menses,
Mm-hmm.
and she described the pain, but not exactly like extended to pubis, but some kind of pain. And I consult Dr. Pata, and we try with Sabina 200C, 3 doses,
Mm-hmm.
more pain. But then the
Oh wow.
subsequent month, more pain, yeah. But then the subsequent month, the next
Mm.
menses come, um, it's okay, no more bleeding.
Oh,
On the
nice.
month itself, the bleeding stopped on the day 7 because
Uh-huh.
she refused to take a hormone pill. She said it's very harmful to her. So we give Sabina 200C day 1, 1 dose, day 2, 1 dose, day 3, the bleeding subside. But more
Mm-hmm.
pain. She said more pain at the back, very painful.
Mm-hmm.
And she hold with it and deal with it. And then day 5, day 7, okay, everything okay. Then the
Mm, nice.
subsequent month, everything okay.
So which potency did you give?
200C.
200. Oh, okay. Anyone else? Anyone else having experience with Sabina? Okay. So what Lenny told are the main features of Sabina actually. There can be dysmenorrhea and that characteristic pain. As per the Materia Medica text, the pain is from the sacrum. It will be radiating towards the pubis, so the groin region. So from back to front, that is the characteristic pain. And along with that, another important clinical feature is it can be given for abortion especially at third month. So that are the important clinical features of Sabina. The common name is Juniperus sabina or savine or tam juniper belonging to the family Coniferae. So the same family of Thuja. So when we say the same family of Thuja, so it is having some of the features of Thuja, especially the action in the female reproductive system. Even Thuja, Thuja is a medicine very much good in female reproductive system. And then both will be having gonoric symptoms, both Sabina and Thuja, and also post gonorrhea. I always say post gonorrhea, the problem will be rheumatism. So all our psychotic remedies, when gonorrhea is there, the miasm is psychotic. So the Sabine is also a psychotic remedy. So it is also good for rheumatism. And because it is a psychotic remedy, even the warts is also important clinical feature of Sabina. So the homeopathic preparation is tincture of young, fresh top of the branches or tincture of the oil. Clinical conditions, whatever I told you, abortion and even moles. Moles means some tumor, but not the exact cancerous tumor. The other one, which is non-cancerous, those tumors. And also, in case of retained placenta, we can give this sabana. It will help in the expulsion of these moles, and that is why if it is given in physiological dose, that will induce abortion also. because it has in physiological dose, it has the ability to cause the expulsion of any content that is present in the uterus, be that a fetus or moles or placenta. So that is what we are using in the therapeutic effect. Then condylomata, or the what's. Then for the gonorrheic conditions, cystitis, the bladder inflammation, gonorrhea, and even gout. All the female-related complaints, dysmenorrhea, leukorrhea, menorrhagia, and also there will be nymphomania. So in Allen's knot, even in Allen's knot, the complete, I mean, all these drugs, what are the drugs for today? Actually, 1 second, I see. Yeah, all these drugs, they are having enough content in Allen's knot. For the exam purpose, you don't have to go any other books. Whatever that is present in Allen's, that alone will do, because there is enough content for all these drugs. So in Alan's keynote, the representation of Sabina is music is intolerable. It produces nervousness, goes through bone and marrow. And music, it causes weeping in case of tuja. Shall I ask you, music is intolerable or make sad? Do you like making or causing weeping like tuja? Do you remember any other remedies? Can you say music
Does
causing?
Netmer have anything?
Huh? Can you hear?
Does Netmer have any rubric on this?
Yes, yes, not more. Anything else?
Not carb.
Yes. And then
Graphite?
yes. Repeat.
Asarum?
No. Asal sound may be sensitive because we are oversensitive to all the external impressions. But yes, right. And then there is another one rubric that is, yeah, like music, the same thing. This is music making her weep. These are the remedies. And if it is music is intolerable, Sabana is there. Do you remember any other remedies? Ambragracia. It is also having intolerable or music intolerance. Then another one feature is in case of music intolerable, in case of Sabina, it produces nervousness, goes through bone and marrow. Such a symptom we say about another drug, not just music, any sound. The person is so sensitive to sound, it feels like the sound goes right through his uh, bone marrow, etc. Such a similarity. Do you remember any drug? It is actually a spider drug. Spider drug.
Is it Pteridine?
Yes. Very good. So, though only in case of music, in case of Sabine, it is music intolerable, but we have this much similarities or comparisons with music. So, music intolerable, we have ambragracia, and music producing nervousness goes through bone and marrow. If it is any sound, not just music, that will be theridion. And music causes weeping will be tuja, natramio, natranca, graphitis, and aconite. Then in physical generals, then there are much more in mind also, okay, that we'll see in the next author's book. But for keynote, it's only this much. The physical generals, the characteristic pain, the pain in the small of back moving from sacrum to pubis, and that is seen concomitant. Now, when we go to the female reproductive system, we see that all the symptoms we say then end with the same sentence. There's a pain from sacrum to pubis. So it is a concomitant which is present in all the complaints. Then a similar one will be Viburnum opulus. This is also a very good remedy for dysmenorrhea condition, viburnum. And for here, the pain is actually from back, going around the body and then to pubis. So it is also going towards the pubis, but before going to the pubis, it will be going all around the body, the abdominal region, etc., the crampy pain, and then it goes to the pubis region. But sticking back to the drawing pain from sacrum to pubis. Do you remember any other remedy which is having a reverse of this symptom? Now, in case of Sabina, the pain is radiating from back to pubis. So, any other remedy which is having pain coming towards the back? Our washerwoman's remedy.
Yeah.
Yeah.
Yes. So it is not, actually, I can't say exact reverse because it is not from the pubis, the pain is coming towards the back or the sacrum in case of sepia. But in case of sepia, all the pain, wherever in the body there is pain, it will be targeting towards the back. So remember that, and why I'm stressing this is even in case of sepia, we have all the female complaints. It also can be indicated in dysmenorrhea, menorrhagia, metorrhagia, even bleat, gonorrheic symptoms, and then even threatened abortion. So, because of that, a comparison can come between sepia and sabina, but then the difference will be regarding that pain nature. For one, the pain from back is radiating to the pubis, and for sepia, pain from different parts of the body will be concentrating on back. That is one difference. And second difference, that is in the sexual sphere, Sabina is actually very nymphomaniac, like the medicine Murex. It is also very nymphomaniac, but in case of sepia, there is indifference. So that is the two differences between uh, sepia and sabina. Then there are characteristic other differences, okay, like the chilly patient, sepia is chilly patient, and sabina is a hot patient. Then the difference in their physical constitution, that is the, but in female, that will be the difference. Then it is more suited for chronic ailments of women, especially the arthritic pain. And arthritic pain, because as I told you, following to gonorrhea, the rheumatic complaints. In skin, the with intolerable itching and burning, there will be exuberant granulation. So whatever, like a cauliflower growth, wherever we see that the moths are growing outside the skin level, and very much similar to like color appearance itself, that we give sabina, and similar will be tuja and also nitric acid. In case of nitric acid, it will be, but in case of sabina, it will be that typical cauliflower like appearance, but it will be projecting out. Type of spots. Not sometimes we see spots which are like a papule. It is not a macule or not in the level of the skin, slightly raised like a papule. But sometimes the spots will be so big and so exuberant that similar to that of a cauliflower, and it's growing out, projecting from the skin level. So that will be the feature of sabina fig spots or warts. And in case the female reproductive system, all the ailments from the etiological factor will be any condition following abortion or premature labor. So abortion, if it is happening, it will be usually in the third month, or premature labor or the preterm labor. And any complaints following to that, we can think about sabina. There will be hemorrhage from uterus. Obviously, you know this in case of abortion or premature labor, there will be hemorrhage from uterus. It will be partly red and partly clotted. Worse from least motion, like cecal cord, This is also worse from least motion. However, the patient feels a relief when walking. So see the contrast in those symptoms. The patient is actually having increased bleeding when the patient is moving about, but still walking give a general amelioration for the patient. And there are also you can see the concomitant pain is extending from sacrum to pubis. Then the a tendency to miscarriages, which we already told at third month. Menses will be too early, too profuse, and too protracted if it is nothing related to what is that, to abortion or premature labor. Regarding the menstruation, too early, too profuse, too protracted, similar to that of Ferromet. In persons who menstruated very early in their life, the flow will be in paroxysm, and as we told earlier, the flow will be partly fluid and partly clotted, with colicky and labor-like pains, and the characteristic pain from sacrum to pubis. So in case of exam, even if you forget the colic or labor-like pains, doesn't matter, but this pain from sacrum to pubis, that is more important. Then there will be increased sexual excitement with discharge of blood in between periods. So there will be meteorrhagia also, that is the discharge of menses in between the periods. And along with that, sexual excitement. Even ambrogracia is having that same symptom. Retained placenta from atony of uterus, intense after pain. So in case if the placenta is being retained, because sometimes the patient may go into a dystonic condition where the uterus actually have to go into its spasmodic crampy nature to expel the placenta after the fetus has been delivered. But if it is not happening and the placenta is getting retained, and as we said earlier, if it is retained placenta or any mons or even the tumors, we can give this medicine for that condition. There will be intense after pains followed to the delivery. If the placenta is being retained over there, the patient will be feeling intense after pains. So the same symptoms we have colophyllum and also Sickle core. There can be menorrhagia during climacteric period, even in women who formerly aborted with early first menses. And menorrhagia during climacteric, if we see such a symptom, it is going towards cancerous condition. There can be inflammation of ovaries or uterus after to abortion or premature labor. So any condition of ophritis if we are getting, or metritis if we are getting, and the patient gives us a history of abortion or premature labor, we can think about Sabina. Promotes expulsion of moles of foreign bodies. Modalities, aggravation from least motion, though walking gives amelioration for the patient. Warm room or air, that is aggravation. And amelioration will be cool, open, fresh air. So when you see these modalities, can you say me another drug which we can compare between Sabina and that particular remedy? Can you say me which is the remedy we need to compare? From the modalities.
Amelioration in open flush. Pulsatilla.
So one difference, no, I mean one similarity you saw in case of pulsatilla also, and also Sabina. The modalities are same. Both are aggravation from warm room, and both are having amelioration from cool, fresh air. Both can be given for threatened abortion. In case of Sabina, we specify it is third month, but in case of pulsatilla, we are not specifying. It is just told there is a chance of abortion. But can you say me from mind and other features how we can differentiate Sabina and pulsatilla?
Restless in Pulsatilla.
Pardon, Vinod, what did you say?
Restlessness. Pulsatilla.
Yeah, restlessness. Okay. But yeah, that one here also we can see the patient is having amelioration, even though the patient is having walking aggravation, still she prefers walking. And restlessness is that not that much characteristic with pulsatilla, not that much. From their mind, can you notice any difference?
Consolation.
Cancellation, yeah. Actually, in this mind, I have not mentioned, but later it will come. Can see in case of Sabina, there is having aggravation from cancellation. And in case of pulsatilla, they are having amelioration from cancellation. And another difference will be with the menses. In case of Sabina menses, we saw that the menses is too early, too profuse, too protracted, and also the person who menstruated very early in life. These two features are opposite in case of pulsatilla. In pulsatilla, the person will be having scanty menses, which is very late also, and it will be mostly what is that pale in color because the patient is already anemic. But in case of Sabina, it is profuse early and protracted medicine or protracted menses or long lasting menses. And this one persons will be having delayed first menstruation. But in case of Sabina, they will be having early first menstruation. So that will be the main difference. Then the general characteristic of pulsatilla, like the fat food that aggravates all their complaints. Then the ever-changing complaints. Or not two symptoms are always similar. So such with special features of pulsatilla will also come up. Otherwise, making the difference between these symptoms, it will be over here in Sabina, too early, too profuse, too protracted menses, and in case of pulsatilla, it will be delayed and also very scanty. And then other one is in case of Sabina, the first menses or menarche will be very early, happening in the early part of the life, but in case of pulsatilla, it will be delayed. So in case of Sabina, as Lenny told, it is Materia, partly fluid-like. The person will be having a closed, feel forsaken, or as if everyone had deserted her, sad, melancholic. But remember the one that is colored melancholic or melancholia, which is aggravated from consolation. Oversensitive to music, or there is sadness from music, it is intolerable going through the bones. The patient desired to be alone. Uh, the patient, crying or speaking about their emotions is difficult. They are not, but that intensity, that they are not talking or crying or speaking, that expression, it comes out at night. And at night, they may cry and talk during sleep. So a woman who had undergone abortion or frequent abortions, we can expect such type of depression, talking in the sleep, during the sleep. Some people we can find, although I have not seen, but we can find, we see in movies and all. So definitely those persons are there. So Sabina is very much indicating. The hormonal imbalance, it really results in excessive sexual desire. Uterine complaints, and it can be anything: polyp, myoma or fibroids, Materia, dysmenorrhea, abortion. Pain in lumbar or sacral region extending to the pubis, miscarriage in third month, and arthritic pain. And this feature, I saw that pain in thigh, especially on the anterior part, aggravation walking. But clinically, how far this is important, I am not so sure. Then in case of aggravation, motion, touch, warmth, because it is a hot patient. And amelioration, everything open air, cold. And desires for juicy, refreshing things or lemonade, almost similar to like veratrum alba. So Stuff, he made the first collection of the symptoms, and Hahnemann and his son were among the brewers. A number of observations were also done on female, and that is how we got the symptoms regarding the female reproductive system. The action of sabina on the generative organs of both sexes is pronounced, because in Allen's keynote we mentioned only about the female reproductive system per se, but because it's a gonorrheic condition, even the male sexual system will be affected. So it produces fig warts with itching and burning of the external genitalia. So the condyle matter, the after to gonorrhea, the condyle matter that is being appearing in the sexual organs, we can think about sabina. There will be phimosis of the male, swelling in the dorsum of the penis or gonorrhea, and in female the uterine hemorrhages, and in case of pregnant women there will be abortion. The same symptoms: hemorrhage that is partly red and partly clotted, aggravation from least motion but amelioration from walking. The flow is in paroxysms, like there will be sudden gushing of blood, and then there will be no bleeding, and then again the flow will be coming out. So the flow will be in paroxysm, and it is accompanied by labor-like pain. The same sentence, because Allen's is taken from Clark. So not Allen's is not taken from Clark. Allen's is taken from Herring's guiding symptoms. But it's the same source book. Every book take its symptoms from here, there. So that's the same sentence we saw in Allen's. But the grand characteristic feature is this pain from sacrum to pubis. So even if you forget all the thing, don't forget this sentence. And this will be a guiding symptom in a large number of uterine cases. In the mental sphere, there will be much irritability. The lady will be hysteric, hypochondriasis, and peculiar features. A close botanically of Thuja, Sabina, is yet not too close to be complementary to that great antipsychotic. But the similarities will be, I mean, what they're saying is that it's a too complex sentence. What they're saying is botanically similar, because both belonging to the family Coniferae. So there is a close botanically similar medicine to Sabina, that is the Thuja itself. They are not that close. There are much differences between Thuja and Sabina, but there are some similarities also, because both are psychotic and then can be from the mucocutaneous surfaces. And when we say spots which are present in mucocutaneous surfaces, there is another medicine coming over here, you know, which is that medicine we saw in Allen's keynote when we were comparing over the what's in that medicine. It will be bleeding very easily, and it is seen in mucocutaneous junctions, so mucocutaneous surfaces, which is the medicine. Mucocutaneous. Whenever we say the main site of action or location is mucocutaneous, which should be the medicine that should come in your mind first? You can never forget again, it is nitric acid. I mean, if you don't remember, another one could be Condurango. Even if you forget Condurango, doesn't matter. But whenever you hear mucocutaneous, something which is present in the mucocutaneous junction, any growth over there, especially warts, only one medicine should come into your mind, and that is nitric acid. Not only one medicine. If one medicine is coming into your mind, that should be nitric acid. Mucocutaneous and nitric acid, they have a very close connection. So Savan is suited to chronic ailments of women, the arthritic pain, tendency to miscarriage, and also to the gouty diathesis. Farrington says it is suited to plethoric women who suffer from what they call rheumatic inflammation, especially of the heels. There is intermittent aching in the solar part of the heels. But I'm not sure how much this is a clinically indicated symptom. But because I saw that it is Farrington who has told that sentence, that characteristic pain in the heel region, that's why I keep it over here. So rheumatic affections, especially of the heels, that also Sabina covers. So there will be intermittency of paroxysmal character, which we saw even in case of menorrhagia or meteorrhagia. Pain suddenly increasing and slowly disappearing. It doesn't matter even if you forget this sentence, let it be there. In case of, by Kent, the use of this remedy is generally confined to the symptoms of kidney, bladder, uterus, rectum, and anus, whenever there is an inflammatory or hemorrhagic symptoms associated. So gonorrhea later affecting, because gonorrhea, if it is there will be cystitis or the bladder inflammation will be there. And if there is cystitis, a back inflammation can happen. That means even the kidneys may be involved. So any inflammation or hemorrhagic symptoms associated with kidney or the urinary organ, the female reproductive system, the rectal and anal region, we can think about Sabina. It establishes a turmoil in the circulatory system with violent pulsations. But whether there is violent pulsations or not, more than that, a turmoil in the circulatory system is very important. And that is why, like pulsatilla, the patient is actually disturbed by heat in a warm room and also from too much clothing because of that turmoil in the circulatory system. Once the window open and to be in the open air like pulsatilla. And this turmoil in the circulatory system is also manifested as a hemorrhagic or hemorrhage in nature. That's why it is a hemorrhagic remedy. It is bleeding from all the mucous membrane, kidney, bladder, uterus. And it has a desired effect in diminishing knots, enlargement, or varices in veins. So good for varicose veins, all type of extra growth, enlargement, tumors, etc. Antidoted by pulsatilla, we saw the similarity, we saw the differences, complementary to Tuja, and compatible to arsenic, belladonna, rustox, and spongia. Spongia will be more related to, you remember, I told you when I was saying about spongia, we always tend to remember spongia only for conditions of cough because there is dry cough. But spongia is a very good remedy for even the heart complaints. It is a good remedy whenever there is thyroid that is involved in rheumatism. So Graves' ophthalmia or there is tachycardia, angina, spongia is indicated. And another symptom, but that is not the feature where it is coming in contact. In spongia, the testicles are involved, the orchitis, or the inflammation of the testes following to gonorrheal symptoms. That is a characteristic feature of spongia. And belladonna will be because of the inflammatory nature, the bleeding also. Sandrastrox, such I don't see any nature. So that is about Sabina. Remember the nature, the mind, the consolation aggravation, the music intolerable, and that is moving right through her bones and marrow, and also making her sad. Then following gonorrhea. So because it is gonorrhea, all the sexual reproductive system or the generative system, male and female, and also the kidneys, the cystitis, bladder, everything may be involved. There will be inflammatory and hemorrhagic sign, increased bleeding, along with that nymphomania, and then threatened abortion at 3rd month. Along with that, the characteristic pain from sacrum to So anyone have given Sambucus? Or anything you remember about Sambucus?
For acute asthmatic cough for children, middle of the night, cough and then suddenly wake up with a lot of sweat. So try one time, 1 dose, 1 ml.
Did I lose you?
Yeah, Sambucus, yes.
So sweat, until that I heard there is a characteristic sweat, and after that what you told Lily?
Because of the cough prolonged, and then very serious middle of the night, and then the child must wake up and then sit. At first, I don't know what to try, but I think of antimonium tart and all that. But because of the sweating, yeah, the sweating a lot. I look at his face, neck, everything.
The sweat, yes, the sweat of Sambucus is very characteristic.
Yeah, so I
important
try
sweat.
1 ml because really very difficult in breathing already. So I immediately give 1 ml and relief. That's what I remember for Sambucus.
I mean, did you give for the patient because voice is breaking from your side? That is why I'm asking you. To whom did
That
you
is
give this
for
medicine?
my boy. That's for my son. Because he has asthma all the while, but his
For
constitution
your
remedy was
son.
yeah. All the while he used
Okay, for your
coconut
son,
cup.
it's okay.
He used coconut cup and for the constitution. But suddenly this time the cough is slightly different. I don't know because his school got a lot of influenza A, and then suddenly middle of the night he has asthma, very difficult in breathing. But only night, especially midnight, 2-3 o'clock like that. So he must sit up. Then I think of antimonium tart because he used antimonium tart before for acute. But I look at the way he sweat is really different from in the past. So I suddenly think of Sambucus. Because of the sweating, I give Sambucus, the profuse perspiration, then he must sit up. He wake up and like suffocate like that, and then really like cannot breathe out the air like that. Very difficult already. So I immediately think of Sambucus because of the sweating.
For them,
A
the
lot of
inhalation
sweating.
is easy, but
Very wet.
ventilation is difficult.
It's very wet. Yeah. I only try with this. The rest I never try with any chronic. Only this acute that I try is very good. And then he sleep through all night. Yeah.
Sambucus is mostly actually an acute remedy, a very good remedy for snuffles also. What you told, yes, along with that for snuffles also. So that is the main feature of Sambucus. Anyone else who have given Sambucus? Now you have a clinic, but you never share any cases with us.
What's that?
For Naim,
Naim. I think Naim has a lot.
but he never
is too
shares
humble.
anything.
He is too humble.
Low profile.
Yeah, that's what.
One day we must go to his clinic.
True. I mean, people who knows a lot, they just try to be very quiet, like what you told, below profile. That's why I especially called his name. Otherwise, I never call his name. I just allow and ask you people because he's practicing since years, and I'm very sure
Yeah. We
he
support
might have
you.
given
We support
samples.
you. Call him more. We support you.
So, Naim, are you hearing? Are you hearing us?
Yes.
Yeah, so
Yes.
you have any clinical experience that is now you share?
Mainly, my problem is I always forgot. That's why I don't share. You
Always.
forgot. I don't remember the case.
Okay, fine. But if you remember, do share.
Okay.
Because now what Lenny told about Sabina, that itself is its clinical features. So rather than I sit here and read the whole PPT, Materia Medica, it is some comparisons I can make. Otherwise, and it is so different from other subjects. Other subject there is a logic. Even in PSM, though there is something to by heart, there is some logic to connect the things. But in Materia Medica, it is more of by hearting, and it's only some sentences that I have to bit explain. Mostly it is self-explanatory. So if we are sharing the cases, we remember the case, we can write at least the main symptoms from that. That is why. So when Lenny told Sambucus the symptoms, it's almost covered also. And that is why I'm asking everyone. So if you share, that will be more productive. It will be not monotonous. That is one thing. You are not hearing my voice always, but then you remember these things.
But at the moment, I tried. I don't know whether correct or not. Just just try to, because we are lack of experience, so I just try. No other
No. I
remedy, no
think
other
you
remedy.
have got more experience than me because most of the remedies when I take the class, I have not given, but you have got experience. So I think when compared to me, yes, you are more towards the clinical side. So don't humble yourself also. Oh, I don't understand why your whole batch is this much showing this much humility. No, please don't. Okay, so Sambucus common name is elder. So there is no clue from here what is the main name. So you can expect a MCQ from here. I'll make it a colorful. Belonging to the family Caprifoliaceae, and this is also an important question. The medicine belonging or the family to which Sambucus is belonging to. It is poisonous, causing stomach upset. And homeopathic preparation is from tincture of fresh leaves and flowers. The main clinical condition is snuffles. So for the young babies, infants, when they have that dry nose and they are not able to take the breath properly, that snuffle condition, Sambucus is our best remedy. So snuffles, one of the offhand prescription we can do is Sambucus. The coryza will be very dry because the nose will be dry, and that is why they are not able to take the breath properly. There will be hoarseness, laryngismus, perspiration or the sweat, which is very characteristic, and whooping cough, also hydrosy. So, but mostly it will be the snuffles, the dry coryza that is more important, and also perspiration. I don't know whether perspiration is a word correct. Make it perspiration. Ailments from mainly the fright, grief, anxiety, all the mental symptoms. Then injury, it mainly result in hydrocele and also excessive sexual indulgence. That are the main ailments from for Sambucus. And in Allen's, the causative factors, as we told earlier, the bad effects of violent mental emotions, anxiety, grief, or excessive sexual indulgence. And excessive sexual intelligence, the other two remedies will be caliphos and phosphoric acid. So, young boys, we do have actually a lot of remedies for masturbation or and onanism, but this because of this, I mean, other remedies we will be remembering, but this one Caliphos will be something that we tend to forget, or we remember Caliphos only as a biochem and having action on the nervous system for the rejuvenation or the stimulation of nervous system. That is what finally it remains in our mind. But Caliphos is a good remedy for nervous exhaustion and also for the excessive sexual indulgence. Don't forget it. Then it is adapted to scrofulous children, and scrofulous means the throat region, the adenoid, the throat region that will be more affected with all the laryngopharyngeal structures in the throat region, adenoid, tonsils, etc. That one's involvement. So the scrofulous children, which affect the air passages especially. Then the symptoms will be the person's formerly. Oh, 1 second. I need to take this call. Okay, so that call was from actually Dr. Nick, the manager or assistant of Dr. Surya Katu. Called to say me that tomorrow the Kajang clinic visit they had to postpone because some ministry from Ministry of Development, Child Development, they are coming to the orphanage for an inspection, and because of that they can't go for the clinical visit tomorrow. So the entire program is postponed to next Tuesday on February 27th. Okay, so to say that only he called me. So let me know how many of you will be on if it is next week. Anyway, tomorrow it is not. Back, who are formerly robust and fleshy suddenly become emaciated. And when you read this sentence, Do you feel any connection to any disease? Affection in the respiratory system. The person wants robust and
Diabetic.
fleshy. Huh?
Diabetic.
Which one?
I experienced before with juvenile diabetic. Suddenly, in 1 week time, lose 14 kg. You're asking about this, right? Suddenly become emaciated.
Huh. Which disease condition? Because the respiratory passage is involved. Person is
Because of
robust.
the young kids with juvenile diabetic, but we don't know. So after diagnosis, only we know he's having the juvenile diabetic type 1. In
Yes,
one
yes,
one
Lenny.
week time, in
Mhm.
1 week time, he lost 14 kg.
Hmm. The juvenile type, the type 1 diabetes
Yeah,
mellitus.
my
Yeah.
late elder son.
Hmm. Ah, okay. Yeah,
Yeah.
but yes, diabetes mellitus, yes, it is important one. But here I told you to connect with the respiratory passage. So then the disease changes. The respiratory passage is involved. Respiratory passage means from nose to lungs, okay? That is involved. And the child suddenly, suddenly, yeah, it is becoming emaciated. Which disease condition we can think about? Very common, very common. Come on, Lenny, Vinod, even Farah. Farah, where are you?
Yes, yes.
Which is the disease?
Wait.
Huh. Come. Go.
Just
Respiratory condition, robust and fleshy child becoming emaciated. Which disease condition? And there is a clue, another clue also, which I didn't mention but earlier, perspiration. Now connect all these and which might be the disease.
TB.
Yeah, TB. The another big clue is here, tuberculina. So this one, now remember TB. She told TB, the tuberculosis. So now you can cross connect everything. Tuberculosis, the child will be the primary pulmonary tuberculosis. So the child is the victim. Child is infected, and then that characteristic sweat, the night sweat of tuberculosis, the robust and fleshy child becoming suddenly emaciated. And the other thing, the most important, the respiratory system is involved. So respiratory system involved means it should be the TB they are mentioning about. So when these features comes up, even TB, if not the complete the TB medicine or the deeper to the TB, this medicine is good at least for the superficial action, the acute action, and then we may have to go to the chronic medicine. So there can be edematous swelling, edematous, edema. Edematous swelling in various parts of the body, especially in legs, instep, and feet. This is also another important symptom which you shouldn't forget in the physical generals. The edema that is seen, especially in the extremities. So, whichever condition in which there can be an edema formation in the legs, the instep or the ankle region, not the ankle region, in between, in the on the feet region, that slowly some depressed area is that one, the feet. So lower extremities. So maybe liver, if liver is having some problem, and then the um, hepatic edema, it may be that condition. So any condition which can lead into edema, Sambucus is indicated. And then there comes the characteristic sweat nature or the perspiration. Profuse sweat over entire body during waking hours. On going to sleep, dry heat return. So when we see this symptom, the person actually is not sweating towards the nighttime. As soon as he closes the eyes, in case of Sambucus, the sweating is stopping. He is sweating only during the waking hours, but once he goes to sleep, the dry heat returns. But now when we see, I asked you to connect with the perspiration also. But the general characteristic feature of TB is that night, that profuse perspiration, the evening chills, etc. But when it comes to Sambucus, there is a slight difference in the symptoms, that the sweating will not be there once the child closes his eyes or goes to sleep. It's only the waking hours the child will be having that profuse sleep. Sweat as soon as he closes his eyes to sleep, the opposite, it will be syncona and conium. So even though the disease symptom of tuberculosis regarding to perspiration and the medicinal symptom of Sambucus with regard to tuberculosis, both are contrast to each other, but many other symptoms are matching. So we could go for even individual prescription over here. And if we get the thing, even you don't have to think like, okay, in case of tuberculosis, there is profuse perspiration at night, and this is not seen. In case of Sambucus, it doesn't matter as long as, because it can be the medicinal symptom, but all the other features is matching towards tuberculosis. So we can think about it. And in respiratory system, there is dry coryza or the sniffles or the snuffles. Nose is dry and completely obstructed, preventing breathing and also nursing. Another remedies that we can think about here is ammonium carb and nux vomica. Ammonium carb is also good for dry type of coryza. And in nux vom, actually in nux vom, do you remember the nature of nasal discharge in case of nux vomica? They have a very particular nature. Anyone remember nux vom?
Is it alternating?
Huh. How alternating?
Is it from block to runny to block to runny?
Yes, it is blocked to runny, but it is related to timing also.
Block at night.
Yeah, blocked at night. So I always remember like daytime the child can, easily go walk, and if it is running also just go sneeze, not sneeze, clean the nose, remove the thing. But at night, okay, the baby is having snuffles, he can't breathe properly, but at least he doesn't have to get up, and if it is running nose, he doesn't have to remove it. He can sleep. He can't sleep because of the snuffles, but still it is blocked. So that is how I always connect. So in case of Naxone, as you told, it will be running in the daytime and in night it will be blocked. So the dry coryza or the sniffles, we have Sambucus, ammonium carb, and Naxone. Then coming back to Sambucus, as Lenny told the exact symptoms, the child awakens suddenly, nearly suffocated. Face will be livid blue, sits up in bed, turns blue because the baby is having like, it is able to get the inspiration, but exhalation is difficult. So he will be turning blue, gaps for breath, which it finally gets. Attack passes off, but is again repeated. Child inspires, but cannot expire. So when this symptom is coming up, that suddenly waking up from near suffocated and not getting breath, we can think about spongia. We can think about even lachesis grangelia. We can think about that. And another two remedies that could be compared is chlorine and also mephitis. Comparison to arum, aurum draconitum. Aurum draconitum, aurum draconitum or arum draconitum. Miller's asthma. 1 second. It is arum. Arum preconicum in Miller's. Then attacks of suffocation has a last stage of croup or the laryngeotracheobronchitis. All the larynx, trachea, and bronchus, if it is inflamed and the characteristic croup comes, they will be having the suffocation. Cough suffocative with crying child was about midnight, hollow deep whooping with spasm of chest, with regular inhalations but sighing exhalations. You may not be able to remember all these extra additional explanations Alan is giving, but if you just remember that it is dry in nature, the coryza, and the baby is having sniffles, difficulty in breathing and nursing. So at the night time, they wakes up, and never forget this sentence: the child can inspire easily but difficult to exhale, which means they will be gasping for breath, they will be going into a livid or bluish condition, a cyanotic condition, and then they get the breath, the situation is calmed down, and after some time it is repeated. So paroxysmally it comes, that will do. Even if you forget this cough was midnight, hollow deep whooping, doesn't matter, but never forget this sentence that inhalation is possible but the exhalation is what that is difficult. Cough which is very deep and dry precedes the fever paroxysm. So before to fever, if there is a dry type of cough, we can think about Sambucus, but it is not the only remedy. That's why I wouldn't color it, because another good remedy might be Spongia and even Bryonia. Fever, there is dry heat while he sleeps or falling asleep, or the perspiration stops. There is fever without thirst. Even though there is dry heat, it is without thirst actually, thirstlessness like that of pulsatilla. The patient dreads uncovering. Even though he is having this much heat in the body, so we expect him to not to cover, but the patient, Sambucus patient, they will be dread of uncovering. So even if there is a increased temperature of the body, they want always to be covered. And in case of Naxomica also, we can see that they are extremely chilly patient. So whatever be the stage of the fever, be it the chilly stage, the heat stage, or the sweat stage, every stage they want to be covered in case of Nux vomica. Aggravation during rest after eating fruit. Amelioration sitting up in bed, because they can't lie down, then only all their suffocation is coming up. So when they sit in the bed, there is amelioration. Motion is amelioration. Most of the pain occur during rest and disappear during motion. Case of as like in Restrix. Then Sambucus nigra, there is respiratory affections with excessive perspiration. That's the in single sentence their symptom. There is suffocative attacks of asthma after to fright, anxiety, grief. That is their main etiological factors. And during the suffocative attacks also, obviously they are going to panic. They will be having fear and anxiety. Mostly a children remedy. The characteristic feature will be perspiration only while when he is awake. And that is one difference, I mean, with the Calcarea carb, Lenny. In case of Calcarea carb and Silesia, and to a smaller level, Calcarea force also, these remedies, they have increased sweat in the head and the neck region, especially when the baby is going to sleep. During sleep time, they have this increased sweating in the head region, head, neck, scalp region. And it is explained that after when they get up from the sleep, even the pillow will be very much wet. And exact opposite is the perspiration of Sambucus. Nevertheless, all these remedies, even Calcarea carb, Calcarea force, Silesia, if the symptoms are matching, we can give for even tuberculosis condition. but the perspiration is getting deferred, and that is where our individuality comes up. Now when you have learned repertory, and obviously when we do the cleavage, you differentiate the symptoms, what are the disease symptoms and what are the patient symptoms. So even if the patient is having a tuberculosis condition, it is clinically diagnosed, but the perspiration nature is different. uh, that becomes the individual nature of that patient. It doesn't make, okay, tuberculosis is having increased perspiration at night, and this one is not having perspiration. As soon as the patient is going to sleep, the perspiration stops, so we can't give the medicine. No, it's not like that. That individuality. So that the perspiration character is very important. And at night, when the perspiration stops, the skin become dry and burning. Still, the patient wants to, or the child wants to, cover the body. Dry heat during sleep, profuse perspiration on waking. Perspiration with aversion to uncovering. They want to be covered. General sweat except the head. Wakes up after a few hours of sleep with dyspnea. The child wakes nearly suffocated. He cannot exhale the air. There is bluish face in asthma. All the symptoms in some way we have told in keynote. That's why I told, if it is for exam purpose, you don't have to study anything other than what is there in the keynote. That itself will give all the important points. Because of obstruction of infants, they will be having difficulty in breastfeeding. And this is some symptom that we can very commonly find in clinics. Like if we are practicing, this is very common symptom that we will encounter. Because what is that, to uh, take, not take, I'm not getting the exact word, but I guess you might be understanding. uh, from the nose. They don't know how to do that. Even young children, they may not be knowing. It will be only the adults who will be trying to do that. But so in case of babies, it remains over there and it becomes dry, and it's a very common complaint that mothers say that the baby is having the nasal obstruction, there is cold, there is difficulty in breathing, but the thing is not running or coming out. It is remaining dry over there, and because of that, the baby is not able to breastfeed also. So that's a very common complaint we can find. And the medicines, ammonium carb, sambucus, and nuxworm will be the three prominent remedies. And from those remedies, you can differentiate and give. And all of this will be having very good action in snuffles. Kidney problem with asthmatic attacks, kidney problem with edematous dropsical swelling of the extremities. Because of that, I told you the edema that is coming. So any condition which leads into the edematous condition of the extremities, we can think. Aggravation lying, uncovering after midnight, beginning of motion, and amelioration like reflux, the continued motion, perspiration, and walking. In case of boric, it's almost the same thing. Action on respiratory organs, dry coryza, edematous swelling, profuse sweat, and sniffles of infants, which is dry and obstructed. When nursing, child must let go of nipple, nose is blocked up, and they cannot breathe, or the breastfeeding is very difficult. So this is another, in Clark, almost all the features have been told. What we have discussed, that is being repeated. So something that I didn't find earlier, that is what I kept over here. So Mills Poe, it says that the bark of Sambucus contains vibernic acid, which is identical with valerianic acid. So this suggests a relationship between Sambucus, valeriana, and viberna, because Sambucus contains vibernic acid, and this vibernic acid is similar to valerianic acid. So Sambucus, viburnum, and also valeriana, they have some common, the common alkaloid that is present. So they have a common feature, and that will be spasm. So in case of Sambucus, the spasm is mainly in the respiratory system. And in case of valeriana, it is mostly in the throat region, because it is a very good remedy for hysterical conditions. So the globus hystericus, all those things, the spasm will be more in the throat region. And viburnum, it is a good remedy for what is that? Dysmenorrhea. So the spasm will be in the uterine region. Anyway, the spasm will be the common feature between these three remedies, and for Sambucus in the respiratory system. And this was proved by Hahnemann and appears in Materia Medica Pura. So one of the chief note, this is edema, the dropsical swelling in legs, in step and feet. Edema can affect the nose, which can result in obstruction, snuffles, the same thing, difficulty in breathing and nursing. And if this edema, if it is affecting the nose, then the child will be having the symptoms of snuffles. But if it is affecting the lower down in the tract, that is then the lung region, it will result in dyspnea. The child will be waking up nearly suffocated, and the same symptoms will be blue, etc., gasping for breath. The attack passes off and again repeated. And the child inspires, but they cannot expire, sleeps into attack. And the other remedy over here, the same sentence where you use this sentence is sleeps into attack, lacasis. The same sentence we use over there. And there will be criteria. Only this sentence, okay, only sleeps into attack, lacasis and grangelia, but not the other thing. Inspiration easy, expression difficult, not the other things, only this sentence. Then it can be given for whooping cough, asthma, but the feature is there should be a recurring attack, because it passes off, as we so that it comes in paroxysm or it comes in spasms. Like it comes off the attack, then it stops, then it will be repeated. So this is the keynote, the tendency of attacks to recur or recurrent attacks. That is another keynote of the remedy. Another grand characteristic is profuse sweat. Then heat, which we have already told. And this is the feature that makes it suitable for the tuberculosis condition. Another fever peculiarities can be deep dry cough preceding the fever paroxysm, fever without thirst, and dreads uncovering. Fever without thirst, can you say me some remedies?
Uncertain.
With G?
It's Elsami.
Eh?
Is it Salsomia?
Yes.
Arsenic.
Peace.
And dreads uncovering, that will be other fever other than the perspiration and the heat, that is dry heat body in the night. The recurring symptoms, other fever peculiarities will be this, but we already discussed it earlier. It is about cases. So NASH, once relieved with 200 of this Sambucus, a very bad case of asthma, having attacks of suffocation of the above kind. Above kind means all what we told over here, this recurring kind of, it will come in paroxysms, it will relieve, that similar kind, what we told about coming in paroxysm. I mean, when the patient lies down, he or she will be having that attack of asthma, and then the face becoming livid, blue, gasping for breath, then which she finally gets, and it is relieved. She again lies down, and the complaint is again happening. So that similar kind, that is what he meant by above kind. That's where the explanation comes. The patient was an older lady. The relief was accompanied by profuse flow of urine also, and that reduced actually a edematous condition. So this lady was having such an acute asthmatic effect and also dropsy. And once this medicine was given, there was relief in asthma along with that profuse urination, which reduced the dropsical effusion from her legs and abdomen. Or dropsy was relieved. The symptoms are generally ameliorated by pressure. Aggravation is rest, lying down. And this one, yeah, head low is aggravation. That is why when the patient lies down, they have the complaint. But the other thing you forget or not, it doesn't matter. Don't forget the timing, 2 to 3 a.m. aggravation. We have Calicup, 2 to 4 a.m. or 2 to 5 a.m. aggravation. And this one is 2 to 3 a.m. And in case of ourselves, it will be 12 a.m. to 2 a.m., 12 to 2. That's their aggravation time. Whenever in drugs, if there is a time aggravation, don't forget the time aggravation, okay? Always keep in memory. So for the drug relations, antidoted by Samb and camphor can be connected with Samb, the night condition, the night asthmatic attacks. And also even in Samb, there is asthmatic, not asthmatic, what is that? Dropsical condition, dropsy, effusion in case of Samb. Camphor, there is spasm, yeah. Spasm is how they might have connected spasm. Antidote to us, compatible with belladonna, conium, nux, phosphorus, rust, and sepia. Follows well after opium, and it is due to the effects of fright. Comparison in Miller's asthma, it is arum draconitum, dyspnea. Oh, this comparison is mostly from the keynote, which I have put in the bracket that has been kept separately over here, that we have already discussed. Yeah, in case of sweating, China and conium, we saw that it is China syncona. They will be sweating as soon as he closes his eyes to sleep, or opposite to Sambucus. And Tuja, they are having sweat only on uncovered parts. Pulsatilla, it is one-sided sweat. So that is about Sambucus, the dry snuffles, asthmatic attacks, coming in paroxysms, recurring, the characteristic perspiration, 2 to 3 a.m. aggravation, fear, anxiety, and grief being the factors, dropsy associated, tuberculosis, because there is a change in the constitution or the physical appearance, that makes Sambucus. The third drug is Sanguinaria canadensis. Anyone having any experience with Sanguinaria? Know the clinical symptoms in which Sanguinaria is indicated?
Right side. Headache.
Right-sided headache, yes. All right-sided complaints. Headache mainly. Then hay fever, rose nose, rose cold nose.
Something about sun aggravation, right?
Hmm?
Something about sun aggravation, I think.
The headache is related to sun. Starts with the sun and then ends with the sun. Yes, and it is right-sided. Yeah. So Sanguinaria canadensis, Sanguinaria, it is red. So the common name will be blood root. Can be asked as a question just to confuse you, because blood root, as such, you don't get the clue to the medicine name. But if you can connect blood, sanguine, and then sanguinaria, like that you can remember. The family is Papaver, and we have other medicines from Papaver, that is opium and chelidonium. So that we have some similarities of these remedies. Even chelidonium is right-sided. Chelidonium is also having an action on liver, right-sided. Even sanguinaria. Opium, we can't say it is right-sided. Then the homeopathic preparation is the tincture of fresh root. Can be given for asthma, bronchitis, climatic condition is climatic condition like lacusis because they have got increased flushing of their body. So climatic conditions, dysmenorrhea, polypus conditions, tumorous conditions like that. Physometra like lycopodium, bromium. Physometra is an important feature. Headache. It will be too much. Just keep the most important one. Rheumatism of shoulder is very important, like especially right-sided. Physometra, headache, asthma, and bronchitis I will put together. So in head, I mean in Allen's not because their headache is very much characteristic. They have a periodical sick headache. I mean every particular time it will be repeated. So here the periodicity is shown in timing, the timing of the day, and also duration also. So when it is duration, the headache which is seen in climatic, that shows its periodicity. But more than that, it is every 7th day. Don't forget this 7th day. So every week they are having the headache. And this is periodical sick headache. And when they say in Materia Medica, when they say sick headache, it is not meaning that headache that make the person sick, but it is the other name or the older name that they use for migraine. So when we go through the feature, we'll see the patient is exactly having the migraine symptoms. As like Farah told, it begins in the morning, increasing during the day and lasts until evening. Like the natriuretic, we say, the sun headache, the glonoid, the gelsemium. Like that, even sanguinaria, it begins in morning, increases during the day and lasts until evening. The head feels as if it would burst or as if the eyes would be pressed out. That is the varying sensation. If ever you have met a migraine patient, definitely they are going to say these symptoms. They feel like the head is bursting, the eyes are coming out. They will say, and even they will say that they can't endure like slightest of the sound or even that light. They might be photophobic even from the artificial light. So whenever they have this attack, they want to, or what they usually do will be, they will be tying their head very strongly with some cloth, and then even they will be covering their eyes also, so that they don't want, and they will switch off the light and any completely closing themselves, secluding themselves, so that no voice from outside will come, because they're going to be very sensitive to all these external stimuli. So even the slightest light don't come to their eyes, they will even cover their eyes also, even if it is perfectly dark. So that shows the this one migraine feature. Even the term American sick headache, that also indicates American sick headache or sick headache. It indicates actually migraine. It is not that the headache felt by the people in America. No, it was the older terminology for the disease migraine. So we see the same symptoms. It is ameliorated by perfectly quiet in a dark room. Just if you have someone in your family with migraine, because it is very commonly found, you will exactly get this type of feature. That itself makes them migraine. Um, in the comparison, another one is epigea. They have compared, and another one is indigo, but I'm not going into that because we are not studying this medicine for as such for the BHMS. So I'm not going to get into make you into confusion. You can read that. And another feature of this headache is it begins in occiput and spread upwards and settle over right. And the same pattern we can see in another drug, that is silesia. And if it is starting from the occiput, spreading all over the frontal and settling in the left side, then we have the remedy spigelia. And if it is whole head, you know which is the remedy? Either side. It will be gelsemia. And gelsemium, rather than either side, we can say it will be coming towards the whole of the forehead. So starting from the occiput, the pain coming towards the frontal region, and if it is settling on the right eyes, we have the right-sided remedies, silesia and sanguinaria. And starting from the pain from the occiput, the same radiation, but settling in the left side, we have the left-sided remedy spigelia. Spigelia, I think we will do in the next week. It is a left-sided remedy. And if it is starting from the occiput, spreading all over and settling on the frontal region, not particular site that is being mentioned, but the whole of the frontal, it will be gelsemium. So it begins in occiput, spread upwards and settles over right eye. That is another feature. And it appears every 7 days. So don't forget the head nature with regard to the duration, the 7th day, with regard to the sun, like natrum mute, natrum carb, chloroin, gelsemium. Then the modality exactly similar to a migraine symptomatology. And then settling or starting from the occiput and settling in the right side. Then this is a good remedy for neuralgia of face. So can be given for herpetic, post-herpetic neuralgia or even Bell's palsy whenever there is a neuralgia. But the feature is more important, like the modality. Amelioration by kneeling down and pressing the head firmly against the floor, almost similar to the Mohammedan prayer. We had such a similar symptom in case of Madorinum, whenever they had breathing difficulty or dyspnea. We had seen that lying on the abdomen and touching the tongue touching or the nose touching the floor, that will be amelioration. But here, in case of sanguinaria, modality is almost the same attitude, kneeling down and pressing the head firmly against the floor. But the condition that is relieving is neuralgia. Pain extends in all directions from the upper jaw. There will be circumscribed red cheeks in afternoon with burning in ears, in bronchitis, pneumonia, and phthisis. This is a concomitant actually seen in case if the patient is having bronchitis, pneumonia, and phthisis, all the respiratory complaints. Along with that, if there is burning nature and also circumscribed cheeks, it is going towards sanguinaria. And this burning, we can see also the foot burns at night, like Madorinum phosphorus, Madorinum phosphorus, and there is some other remedy. Where the foot is so burning that they remove the cover, the bed sheet from them. But because of this circumscribed, even if you don't remember in bronchitis, pneumonia, and phthisis, though it is an important concomitant, for the exam, even if you forget, doesn't matter. But the circumscribed red cheeks, you can connect it to the climactic complaint, because this lady, they will be having that hot flushes, that is what the burning nature, and then along with that, red cheeks, circumscribed red cheeks, the mala flush, what we say. So that is better indicated in sanguinaria. So the circumscribed red cheeks is a very important term, you shouldn't forget. And in medicine, we use the term malar flush. Then in the respiratory system, they have asthma after the rose cold. Yeah, that was the term I was searching when I was saying the rose cold, which means hay fever. Okay, hay fever. So hay fever, it starts actually as a hay fever or that allergy, the pollen allergy, whatever. They go into the spring season or that small dust or whatever, that hay fever, allergy, and then it will end with asthma. So it simply starts with a coryza or breathing difficulty, and then it will go into the lower respiratory tract, resulting in severe asthma. That is the feature of sanguinaria. There can be laryngeal or nasal polypi, a good remedy for that. But though I don't know how much this medicine will be useful in case of, I mean, in a clinical way, because nasal polyp is a common condition we can find in our clinics. I have seen tucrium, my teachers being giving a patient, and I have never seen this one being relieved. Okay, like a nasal polyp completely getting vanished. I have never seen that. Even I have seen teachers prescribing sanguinaria nitricum, but what I have witnessed is the symptoms get much ameliorated because of the nasal polyp. Most of the symptoms is they can't take the breath properly, resulting in dyspnea, frequent attacks of URTI. Those symptoms will be relieved. That is what I have seen, but I have never seen the size of this polyp being really reducing. Maybe also because, as I told you, whenever we have the clinical, we have actually got 6 OPs, one for each subject. So we will be in rotation in each clinic. And in one clinic, we will be having only for 1 month. So, yeah, Organon and Materia Medica, I think we had a rotation for 2 months. All the other subject it is for 1 month only. So, and in Organon and Materia Medica, I don't know, mostly Organon, not Materia Medica. Materia Medica also teachers prescribe all the rare remedies, but Organon, I have never seen my teachers prescribing they completely stick on with the Organon, the philosophy. They don't prescribe any rare remedies. They always stick on with all the polycrest, the pulsatilla, the Tuxmom, belladonna. Only the polycrest they will prescribe, nothing else they will do. In Materia Medica, the teachers do go for rare remedies and other departments also. But then, as I told you, they will be giving medicine for 1 week, usually. If it is not high fever, they will be high fever only, they give the medicines for 1 or 2 days. Otherwise, the medicine is given for 1 week. So sometimes 2 weeks. If it is more chronic, they give the medicine for 2 weeks. So when we have that 1 month posting, we are seeing that patient only twice if the patient is regularly coming. If the patient didn't come the following week when the patient was supposed to appear, if he doesn't come, we are not seeing the case also. So that problem was there. So maybe because I was not there constantly watching, and then we again go to the Organon OP or the other OP the next year, because every year the subject that we are studying, according to that our OP changes. So that may be the reason when I didn't see the result actually, but I have seen teachers prescribing not Sanguinaria canadensis, this one, Sanguinaria nitricum and Teucrium. Sorinum I have not seen, okay. Mostly Teucrium and Sanguinaria nitricum is what I have seen they giving. Then cough, it is dry, waking him at night. Sambucus, But in Sambucus, it was not cough actually. He was not getting the breath, but here it is cough. But that is not the symptom that you have to remember. You have to remember passus flatus. That is the symptom more important over here. So the patient is having an amelioration from cough only when he sits up in the bed and passes flatus. Such a peculiar symptom that makes the importance. There will be red circumscriptions and also diarrhea. So even these symptoms, the night sweat and diarrhea, it is also going towards a tuberculosis affection. Severe cough after whooping cough. The cough returns every time patient takes cold. In GIT, there is burning in pharynx and esophagus. Doesn't matter that much. Burning in extremities, that matters more. So even if you forget the sentence, doesn't matter. So extremities, as we now told, the rheumatic pain, and that too in right arm and shoulder. That is the characteristic feature. If it is left-sided, it is pheromet. And aggravation at night. Oh, last week, a patient came to me and he is having symptoms similar to that of frozen shoulder. And actually, he is having this symptom. He told that right arm and shoulder, that is what he is not able to raise up also. The maximum is this much he can raise. And when I asked him to try to scratch his back region, he was not able to lift up his hands, the shoulder region actually. So when he was saying the right side, he was always saying right side, right side. I thought of prescribing sanguinaria. But then I asked, he never had the complaint with the left side. Then he told, no, no, left side is also the
And again,
okay. Thank God, came back. Are you seeing me? I mean, are you seeing the PPT?
yeah, I can see. So it was, he also had on the left arm. Hello?
Are you there? Am I there? Anyone hearing?
Yes, yes, yes.
Yes, okay. God knows when it is going to go. So what were we? Sanguinary. So that right arm and right shoulder, and if it is left-sided, it is Ferromet. I have tried this Ferromet, okay, for left-sided shoulder pain, and it worked. It worked very wonderfully. It was relieved. So this patient who came, I wanted to give. Was mentioning right arm and shoulder. I thought, okay, I will give sanguinaria. But then when I asked him about specifically left side, then he told, no, left side is also there, but not as severe as that of right sided. So when it comes to both sides, medorinum is the remedy. But I didn't want to give him medorinum because I was not getting proper indications. Other than this feature, I was not getting any having symptoms aggravated from like a rustux, symptoms aggravated from cold wet weather, and amelioration from warmth. And medorinum is actually opposite. It's a hot medicine or patient. So then I didn't want to go for medorinum, and then I ended up with not even Restox. Not even Restox. I ended with Ruta uh, because mostly it is the bones that were, because one of the sentence the patient told was, it is not the muscles that is affected. I don't have any complaint with muscles, but it is the bones that is affected. The movement of bone is my problem. That is what the exact sentence he told. And I thought, okay, because of the action on the bones, let I try with Rota, and I gave him Rota, and I asked him to come next week. So let's see what is happening. So this is a good remedy for frozen shoulders if it is right-sided, and left-sided is Param, both side is Medorina. They cannot raise the arms, aggravation at night. And another feature is pain in places where the bones are least covered, like tibia, back of hands, etc., like res veninator. And this symptom is also very important. So female reproductive systems, I told you the climatic ailments where there is flushes of heat, that that circumscribed red cheek, the burning of palms and soles. So that's what I told you, burning of feet. And even you forget burning in pharynx and esophagus, doesn't matter. Actually, burning is the concomitant, but still, even if you forget the other burning, doesn't matter. But don't forget the burning of palms and soles. And they are compelled to throw off the bedclothes. For the painful enlargement of breast when laxative and sulfur fail. Actually, I'm not sure how much, because I have never given such medicine for such a complaint, and I have no clinical experience. But for a MCQ, this is important. Eruption on face of young women, especially during scandy menses. So, calcarea, Eugenia jambolanum, and also sorina. So remember sanguinaria for the headache, seventh day headache, the sun headache, migraine, amelioration is totally quiet in a dark room. Then that particular neuralgia with that particular position or the posture that they get amelioration from. Then the circumscribed red cheeks, the burning palms and soles, and the climatic complaints, and the right-sided arm and shoulder pain. That is what sanguine is about. So, and cough that is ameliorated by passing flatus. Complaints, especially headache, amelioration, vomiting. Even this is a feature of migraine. The patient will be having nausea and vomiting also, and vomiting relieve their symptoms. So, mind as such is not important, but we can just go through. There is lassitude, indisposed to move or make any mental effort. She doesn't want to. Delusion, she was in some vehicle which was moving and jarring her. So she begs others to hold her or desire to be held. Oversensitive to noise. And person is extremely irritable or morose. The right-sided remedy affecting the liver, chest, right deltoid, like the chelidonium I told you, belonging to the same family. Vomiting, nausea accompanying ameliorated by passing flatus or even eructation. Headache every 7 days, photophobia, right occiput, and then extending to the right arthritis of shoulder joint, right arm, same symptoms, same symptoms. What you learn in keynote, that itself gives the whole point of the drug. Don't have to refer any other books. All arthritic complaints aggravated by wet weather, right-sided coryza, sensitive to odor, heat and burning, uncovers the feet. Cough, even that is ameliorated by eructation and flatus. So even the headache and cough both are ameliorated by eructation, flatters. Aggravation, stormy weather, motion of affected part. Just remember stormy weather. The right-sided, you can connect it with rest talk. So even the stormy weather, amelioration, vomiting. Desire, not so important, okay? Doesn't matter even if you forget. It is highly seasoned, pungent, frequent things. Getting a case and you are having a difficulty to differentiate the drug, then if you see this, you can go. Otherwise, desires and aversion of sanguinary is not that important. In boric, it's mostly the right-sided remedy, the vasomotor disturbances. That is why we get that circumscribed red cheeks, the flushes, and also the burning sensations. Influenzaal cough, phthisis, doesn't matter. This one is an important point as a MCQ. Sudden stopping of catarrh from the respiratory tract followed by diarrhea. So what we saw was the person will be having hay fever, like exposure to the spring or the pollen can bring about a hay fever, and that will end up with asthma. And another one is if the person is having catarrh from this one itself, the nasal catarrh, trying to suddenly check that or suddenly control that because the amelioration is mainly from all the discharges, like what we saw, even the flatters, the eructation, everything that is coming out, the discharges in one way or the other, that is giving an amelioration. So when the catarrh is actually coming out, we should have allowed it. But if they are going to suddenly control it, will be ending with diarrhea. So the problem started with the respiratory system, catarrh, and then they do something which resulted in the stoppage of the catarrh, but resulting in diarrhea. It is a peculiar symptom. I don't know. I mean, I have not seen a patient saying this symptom ever, but I don't know whether we will meet somewhere in the clinic. But for MCQ, this is important, and this seems to be very strange. Problem, it starts with the nasal, but ends with the GIT. Did we come back? Am I there? No. That's all. What is happening here? When you're coming back, just someone give me a response that
Yeah, I can hear you.
because it is not showing from me from this side whether the internet is there or not. It is still showing internet connection is there. It is not showing that red or yellow, but I lost the connection because of the voice in between. The voice means I understand that I lost you when the voice comes, but it will be for some time only. So whenever you're coming back, just respond to me, okay? So Borik, we have the same symptoms: the neuralgia, the reddish, the burning, nasal polyp. Don't forget the nasal polyp. And because of that same feature, don't forget even the ear polyp, oral polyps. Aversion, but it is not that important. Yeah, another symptom you have to remember from here is cancer of rectum. Uterine polyp. This is, I won't say the sanguinary respiratory, whatever we learned in Allen's that will do, the hay fever and that resulting in that cough and that amelioration. But here it is going more towards a pneumonic condition. So if you can remember a few symptoms from here, it might be okay, especially the cough of gastric origin, which is relieved by eructation, because we saw it earlier that eructation passing flatus, that gives an amelioration. There will be a burning pain, which is a common concomitant in case of this remedy. But yeah, this one will be very important. The rusty colored sputum. And when we say rusty colored sputum, it is going towards pneumonia. Uh, I won't say you to remember all these things, stupid things. Asthma with stomach disorders like nux vomica. Severe dyspnea with offensive breath and purulent expectoration. But no, I would say only this colored ones. Remember only these symptoms. Other things, it's okay. When we say rust-colored sputa, it is going towards pneumonia, and also that is indicating actually hemoptysis. The cuff, that sputum will be stained with blood. Extremities is the same, the rheumatism of right shoulder. Then they say about left hip joint and nape of neck. For the exam, I want you to remember. For exam, it is only this one, the right shoulder, that you have to remember. Burning in salts and palms. In skin, it antidotes rust poisoning. It is similar to the rust vesicular eruptions, the red blotchy eruptions. Acne with scandimensis. In another term, we have done this in actually Allen's knot and circumscribed red spots also. So in case of Clark, it is some cases, burning is one of the most important feature of this drug. So Mr. F, 48, a sanguinobilious temperament with pain in stomach several months. And someone had given him a decoction of bloodroot and boneset in tablespoonful. Now, when we see the bloodroot and boneset, we understand the medicines. Bloodroot will be sanguinaria and boneset will be eupatorium. So the sanguinobilious, even eupatorium we study, it is a bilious temperament. So someone had given him a decoction of this sanguinaria and boneset, and that actually aggravated his complaint. Each dose produced intense burning pain in the stomach, lasting 4 hours, and then he discontinued. Several weeks later, he consulted the homeopath, Winterburn, and he had these symptoms: burning in epigastrium, pressure, aggravation at night, uh, but coming on soon after lying down. And compelling patient to rise. Erections giving no amelioration. What we learned is erectation giving amelioration, but the patient didn't have erections amelioration. Appetite great, bowels torpid, and unsatisfactory relief each morning, and the peculiar drawing pain in shoulder and arms. So after with all these symptoms, sanguinaria 200 was chosen. At the same time, the person compared the medicine to nuxworm, graphitis, etc. And still, sanguinaria was given every night at bedtime. After the first dose itself, the symptom disappeared like magic, and the patient was soon well. Maybe this we could also say that the patient actually had stomach complaint, yes, but because of taking this blood root in that decoction form, maybe it resulted in a physiological poisoning. So giving that in a potentized form relieved the complaints. Then another case is Mrs. S, 30, a chronic inebriate, drinking steadily for 3 weeks during sickness and diarrhea sets in. Nux 1x was given, which aggravated the nausea. RSALF 6 was given, which checked the diarrhea. But still, there was no relief for vomiting. Patient was irritable, angry. Everything she took was instantly ejected or vomited up. Every 20 minutes, she had a spasm or cramp of the stomach, gagging, coughing, bringing up some frothy mucus. Then there was intense burning from the stomach up to the esophagus, which felt swollen and dry. That burning, see the symptom here, burning is a leading knot. So this actually cases are indicating that feature of burning, which led them to give the medicine. The only tolerable position was lying slightly turned on her left side. Lying on right was impossible. Sanguinary 200 was given every 2 hours, and then the symptoms were relieved, especially nausea, but the burning pain remained as before. She slept better, but never again next morning in a fright. Afternoon, she was able to take some solid food, and then afternoon on, the recovery was very rapid. So what they finally say is, over this symptom, there were so many symptoms. In this case, so many symptoms are being told, but the characteristic feature what they selected for sanguinaria was the burning. The flush face affecting the respiratory tract. This itself, I still say you don't have to study for the exam purpose. It's just for you to read the explanation that is being given. Yeah. So here you get the clue towards the hay fever actually affecting the whole respiratory tract, irritating the nasal mucous membrane, causing coryza, and when we are diarrhea. There is perverted sense of smell or sensitiveness to the odor of flowers, which means it is indicating towards the hay fever. Influenza, ozena, polypus, everything comes within the range. Like chelidonium, as I told you, sanguinary is a right-sided remedy because both belong to the family Papaver, and it's suited to pulmonary affections with liver involvement. Like chelidonium, sanguinaria also has a reputation for curing cancer, polyp, and new growth. I have seen breast tumors diminish under its action. Acridity, the breath and flatus are also very offensive. It's a feature. The neuralgia we already discussed. Fullness and tenderness behind the angle of jaws is according to Cooper a keynote. What we learned over here, that tenderness, that neuralgia, and kneeling down, which is giving an amelioration. The rheumatic pain, right arm and shoulder, same thing. Pain in places where the bones are least covered. It antidotes opium because both belong to the same family and compatible with belladonna because of that reddishness. It is also having that mala flush, the circumscribed red cheeks, and even belladonna, we get that flush, that reddishness. And this is some comparison. Can just go through that. Rheumatism of right deltoid macabre is also there. Headache, amelioration, heart pressure. This one you remember, okay? Paroxysm of headache ending in profuse urination. It's very good to remember. Menstrual headache, sepia. Offensive breath with cough, capsicum. That's also good for MCQ. But I don't think capsicum you are studying this semester. Then, yeah, melilotus and bell, because in are we back?
Yeah.
Are we back?
Yes. Yes. Can hear you now.
Yes,
So
we can hear you.
congestive headache, we have belladonna and also melilotus. And in case of melilotus, there is amelioration from nosebleed, if you remember. Belladonna has cold feet and hot head and is ameliorated by sitting propped up. But sanguinaria, it is amelioration from lying down. It's aggravated from sitting. The periodic sick headache, if, we learned that in case of sanguinaria, it is every 7th day. and in iris versicolor it is every 8th day. These things, the drug relations, it is more. I mean, yeah, clinically it is like a 1 point indicators, but I mean, for exam purpose, mostly in case of MCQ. That's what it is coming. Then this one we already discussed from what in the keynote itself. This medicine I have never given, okay, Sanic I have never given. It is some medicine I hate to study actually. I always study and I always forget Sanicula. This is a mineral spring water medicine from USA, Ottawa. So dilutions of the spring water or triturations. Does anyone have any connection with Sanicula? You have any experience with Sanicula?
No.
Even I don't have. I have never seen even my teachers prescribing it, but they have got such a lot of symptoms, such a lot of symptoms. Actually, it could be acts as a Sanicula baby or a child. So many symptoms they have, but I have never seen clinically it being given. So you see the different type of symptoms they are having. It can be given for amenorrhea and the female complaints in general. Emaciation, and that will be mostly related to the malnutrition or diabetes, enuresis, because I told you this is a child remedy. Food sweat, one of the most important etiological factor for Sanicula is food sweat or suppressed sweat. Then milk thin or thin milk, especially in lactating women. The scrawny women, if they have some problem with their milk, it is not thick enough or very watery. Sanicula is a medicine. Then night terror, even that is getting associated to the child remedy. Dropsy, rheumatism, rickets, scurvy, and rickets, scurvy, rickets mainly. Are we back?
Yes.
Okay. Then tongue ringworm off. Uh, this is this is like important for a MCQ. I have not seen ringworm affection on tongue, but it is even told as a specific. Helonius, we can think about Sanicula also for the uterine prolapse. So even though this much clinical conditions are there, it is very difficult. I mean, I have never seen this medicine being prescribed. Sanicular causation is strains and I'm very sorry for the internet connection. Get mad. Are we there?
Yes.
But I think disappeared again. Huh?
Yeah.
Can you see me? Hear me?
Now, yeah.
Now, yes, but breaking.
Yeah, okay, it is breaking. Yeah, I understood. Every 1 minute, 2 minute, it is continuously going. Let's see. Uh, okay, we have only two more remedies, Sanicula and Sarsaparilla. I'll try to go very quickly. So, in mind, they are having a dread towards downward motion, like what we learn in case of borax. The child will be headstrong. As I told you, this is one, it can be asked like a 5 mark question or 7 mark question. Sanicula, explain a Sanicula child. So, child will be headstrong, very quickly, alternating with laughter, does not want to be touched. So, similar to all the other stupid child remedies that we see, chamomilla, sina, rheum, yeah, they are stupid children, even like abrotanum. So they are dread of downward motion. This is important. And child headstrong and obstinate. It's also important. In that condition, even silesia may also come. But they occupation. That we can come to the adults also, but also in case of children that they're very restless, so they can't sit in one post or do one thing. They will be constantly, even the playing thing, they will be constantly shifting. Then physical generals, the symptoms are constantly changing, like lacaninum and pulsatilla. So even in the mind, they are changing occupation. They are very restless, and similar to that, even the symptoms like pulsatilla and lacaninum, even pulsatilla and lacaninum, the symptoms are constantly changing. Foot sweat is very characteristic in between the toes, making them very sore and offensive on soles as if he had stepped into cold water. The foot sweat of Sanicula is very important. Child kicks off clothing even in coldest weather like heparin and sulfur. So very hot in nature. And another one is emaciation. Emaciation, when we go for this emaciation, see the difference. In case of Samb Can you hear me?
Now, yes.
Can you hear me?
Yes.
Yeah, now,
Yeah,
yes.
now yes.
Okay.
But later you will disappear.
Yeah, within 2 minutes it's going to. So what I will do is I'm just sticking out with Alan's keynote and the Boric. In Clark, what I have put here is only the cases a year on. I'll just explain this one and try to finish because I don't know how much it is going. So, so we were saying about the emaciation. Read the emaciation of this medicine, how the emaciation differs here. Here the emaciation is progressive. Child looks old, dirty, greasy, and brownish. Skin about neck wrinkled, hanging in folds. So emaciation, and then there is loss of muscular mass, and that is why the skin is hanging loosely, because the muscles underneath, they have got like, because of the emaciation or the lean muscle mass being lost, the skin will be hanging loose. If that is the emaciation, what will be the disease condition? Are you hearing me? Yeah. Did I lose you people? Are you hearing?
Yeah,
break,
yes.
break.
Yeah. Yeah.
I
Okay.
can hear, but
So,
breaking.
okay. So what I'm saying is the emaciation in case of Sambucus, it was related to the respiratory system, and then they were robust, and then they were becoming emaciated. We connected to the perspiration, and we went, it is tuberculosis. And in our book, Materia Medica, when we see emaciation, in which they say this particular skin becoming very greasy, oily, and the child look very old, or premature old age looking, and also the skin hanging in loose folds, because the muscle mass is being, muscle mass is being lost. That condition, that emaciation is related to the protein energy malnutrition, which is marasmus and kwashiorkor. That emaciation. So the way in I'm is explaining in Materia Medica, and how we can connect it to different type of diseases. Just connect that emaciation with the other features, and then try to see, you will understand the symptoms. So emaciation, and that marasmus symptoms we have in case of abrotanum, iodum, natramure, sarsaparilla also. So Sanic is a very good remedy for marasmus. So that is another feature which will come in Sanicula child. The next symptom, head and neck of children sweat profusely during sleep, like calcarea, carp, silesia, we told earlier. So here also in
Pain, but this area is too much red. Why?
if you have time, can you wait, because we are
Away.
okay. So can you come tomorrow, because even I'm taking class and another doctor is taking class.
Just show, please.
I'm taking class. The class is happening.
How many times?
Just wait 10-15 minutes.
Okay, then I'm here. Okay.
Uh,
Why explain morning?
okay. You go from here actually. It will be always closed. Go from here. Okay, so even the sweat condition, the child like calcarea, carb, and silesia we discussed earlier, they will be sweating very profusely during the sleep, even wetting the pillow far around. That is the nature. Profuse scaly dandruff on scalp, eyebrows, and also on the beard. Now, when you see this, that is only one or two symptoms. The another one, when we go to ears, there is soreness behind ears, and like graphitis, what we learn, there will be a sticky viscid liquid that is coming from, or sticky viscid discharge. That feature also we see. And flabby, burning, and the characteristic feature is this one. Okay, this one, all I will make the normal color. Tongue, it will be burning, and the patient have to protrude it to keep it cool. And also ringworm on tongue. That symptom also is very characteristic. So what I wanted to say is, Sanicula, I told you I hate this remedy because there is no logic sometimes. At every symptom we have to by heart, not only to write the essay, the Sanicula medicine, the Sanicula child, but also it will, all these questions, it can be asked. I mean, it is good for MCQ actually. If you say this one, the head and neck of children sweating profusely, that usually doesn't come for. It is important when you are writing the answer, a Sanicula baby, but otherwise MCQ it is not going to come. But this one, profuse scaly dandruff on scalp, eyebrows, and on the beard. It is a unique feature. So this can be asked as a MCQ. The soreness behind ears with white, discharge of white, gray viscid fluid. That can be asked as a MCQ. And that will be usually comparison. Sanicula, Sanicula and graphitis, and then Sanicula, graphitis, and sorinum, and last option may be none of the above. So like that, this may be asked. And the other feature of tongue is either that it is burning and have to protrude the tongue out, or the ringworm on tongue, sanicula comes. So this sanicula, all the symptoms are very important. You have to logically fit in case, though it is not mentioning the child this symptom, the child can obviously have this symptom. This one, the discharge coming from the behind the ears, and even the dandruff on the scalp and eyebrows. Even if the child is not going to have the beard, but scalp and eyebrows are there, and the dandruff having the, then the tongue burning and have to protrude it to keep it cool. That also is an important nature. So someone's audio is open, I mean on. Can someone, that person close the audio? This audio is open. Okay. Then for the GIT symptoms, there is nausea and vomiting from car or carriage riding. Like ourselves, they have the symptom thirst, which drinks little and often, and it is vomited as soon as it reaches the stomach. So that symptom is similar to ourselves because they drink little and often, and something that is taken in when it is becoming warm, it is vomited out. That is the feature of actually phosphorus also. They have constipation, which is very characteristic, okay, and it is very much offensive. All the discharge, even the foot sweat, everything of sanicula is very much offensive. So in case of constipation, this is also very important. uh, the feature is it is having the order of Limburger cheese. Don't forget this comparison that they have made. It simply means it is very offensive, but it can be asked like an MCQ. So the constipation, the stool, which is having very offensive, or the order of a Limburger cheese. I don't know what is Limburger cheese, but anyway, it means it is very offensive. That is a feature of Sanicula. But other features is they don't have a desire to pass stool until there is a large accumulation, similar to that of Melilotus. We have that similar symptom. And they have got a shy stool that is partly will come out and partly it will then recede back, like Silesia and Fuja. And even sometimes the stool have to be removed mechanically, like using fingers or something. They have to remove the stool, and the stool will be coming out in dry gray balls. Uh, and sometimes, like Magmore, the stool may be crumbling from verge of anus. Now, this one I actually can't color anything. Even though I color or don't color, every symptom over here is very important. It can be just asked as like Sanicula GIT. So every symptom comes over here. They have got incontinence of urine and feces, like allo, the sphincter is unreliable. Uh, there is urging from flatus that the person want to pass stool. It is also similar in case of allo, and the patient has to cross legs to prevent feces from escaping. The same symptom we have seen in case of sepia, lilium tigrinum, especially to prevent the prolapse of uterus. Here, this attitude is taken not to prevent the prolapse of uterus, but to prevent the defecation. Because that much incontinence they have. They have from the flatus movement itself, they feel like to pass the stool. So they have to cross leg to prevent feces from escaping. Then not just constipation, they even have diarrhea, which is very changeable in character. Like now, remember this, like scrambled eggs. All the comparisons, how they make it, you need to remember. Lily, can you just off that audio from your part? Okay, it is frothy grass green and turns green on standing, like a scum of frog pond, like what we learned in case of macabre and magmoor. After eating, I must hurry from table. And the child will be having order of stool after bathing also. So that is a smell they use with sulfur. So even the child is bathed, the child will be having that offensive smell. Even the constipation, if it is constipation, there is the odor of Limburger cheese. And if it is diarrhea, like scrambled eggs, scum of frog pond, that comparison is given, which means it is also offensive. And ultimately, even if you take or give bath to the child, that smell of stool is not going to leave the child. Then in case of female reproductive system, we go to the leucorrhea. Even that is offensive. They say it is the order of fish brine, the salted fish, the salted fish, like that offensive it will be. Then some comparison is made with calcarea and tellurium. Forget about it. Then, as I told, there will be uterine prolapse. So there is a weakness, a bearing down sensation as if the pelvis would escape. And then the amelioration is by aggravation is moving, and amelioration that is by desire to support parts by placing hand against vulva. Sorry, it is vulva, like lydium and murex. Then what is that? The burning of salts of feet, like what we learned in case of sanguinaria. Even sanicula is having that burning of salts of feet, and they have to uncover, put them in a cool place, like that of the tongue. That is also important feature. And then excoriation of the skin about the anus, in the perineum and extending to genitals. So all these symptoms. Now, when I read this, you might have already felt like there is no connection between all the symptoms, and that makes sanicula a very stupid duck to remember, to memorize. But do remember, somehow try to remember, because all these symptoms are very important. Individually, it can be asked for MCQs also. So usually it will be the GIT symptom that is asked, or even the child, this one, sanicular child. So remember the downward motion, the mental nature, constantly changing nature, even the symptoms changing, the foot sweat, and every discharge, be that foot sweat, the constipation, or diarrhea, or leucorrhea, everything is very much offensive. And not just offensive, you will get more mark if you say that specific feature, like constipation, comparing it to the offensiveness of Limburger cheese, the diarrhea to the frog scum, or the frothy molasses, and then what is the leucorrhea being compared to the fish brine. So do remember. Then emaciation, which is the marasmic type of emaciation. Then the tongue nature, where it is the ringworm affection, or even the burning, that much should be protruded to keep it cool. The scaly dandruff on scalp, eyebrows, and on the beard. GIT, don't forget the constipation, the incontinence, the thirst nature, and the diarrhea nature. And also in female, leucorrhea and the uterine prolapse. And finally, extremities, burning of salts. So sanguinaria, the fishy odor of discharges, so very offensive discharge, that is the feature. The child is very irritable, peevish, restless and stubborn. They have changing occupation, constantly desire to travel, similar to that of tuberculinum. They fear something bad will happen, of dark, of robbers, of downward motion. They are having aversion of being touched. Then offensiveness, as I told, the fish brine or rotten cheese. Uh, then burning pain, light colored stool, and no desire unless a large accumulation, which is similar to melillotus, offensive perspiration. Okay. Now it is the feature, it is what Clark given, and it is mostly the same symptoms actually. Dirty, greasy skin, scrofulous conditions, cold, clammy hands and feet, which is very foul smelling, hair dry and lusterless, dandruff on scalp, constipation or diarrhea, pot-bellied, rickety children. What we learned that exact feature. Uh, Please don't stop from here. Both are taking class. If you can, you come please tomorrow. Okay, so children, they are very stubborn, get angry. Not much important. Yeah, successful use in tree sickness and seal sickness, but clinically we have better remedies, Coculus, tabacum, to think about. Yeah, so some cases is also mentioned where there was a cold, clammy sweat. Stockings were always damp, and 2 doses of Sanicula 10 and 50 cured all the trouble. And all these are cases you can go through. I'm not reading it now. This is a case of Boger. Sanicula 10 was given. Then constipation was Sanicula 30 was given. Is the drug relation almost similar to what we already discussed in Alan Skinner? The same thing is being repeated over here. Remember this ringworm on tongue, okay? And I don't know whether you will get such a clinical symptom ever. Then last one is sarsaparilla. Sarsaparilla, do anyone remember the symptoms?
The UTI very painful. Yeah, I have a case with sarsaparilla.
Okay. Anything else?
It's a young lady, 14 years old. At the end of her menstrual, according to her, she said maybe hygienic problem. So she suddenly have very sharp pain when she's trying to urine.
Yes.
Then then she's shouting and crying in the toilet. It's my neighbor. So I immediately gave sarsaparilla and relief.
So this is actually a very good remedy, especially when the pain is ending towards the end stage of urine, end stage of micturition. If then the pain is the sarsaparilla is more indicated. So urinary complaints, where there is dysuria, especially at the end of urination, that is sarsaparilla's indication. And this is also good for marasmic condition. The skin is also shriveled over here. Sometimes something similar to sanicula also. Its common name is wild licorice, so can be asked as a MCQ. And homeopathic preparation is trituration and tincture of the dried rhizome. Clinically, all the urinary complaints, bladder affections, dysuria, and enuresis. Bone affections, especially like sanguinaria, where there is less covering, less muscular covering. What we learned in sanguinaria is similar to that. There is breast cirrus complaint because one another feature of sarsaparilla is there is retraction of nipples. So that is usually seen in cancer condition. So for that complaint, we can think about sarsaparilla. Bright's disease, the glomerulonephritis, connecting once again to the urinary complaint, calculi or renal calculi, and this is also right-sided renal calculi or renal colic. We can give sarsaparilla. Then gout, the skin is chapped like graphitis petroleum, the marasmus symptoms. Again, I wrote ruggeds. Are we back?
Yeah, now yes.
Okay. So it is mainly seen in dark-haired persons or constitution who is having lithic, that is the stone or psychotic diagnosis. So having that stone or some psychotic background, that is the constitution. And because this is a good remedy for marasmus, and marasmus, whenever we say marasmus, without even checking whether that symptom is present in keynote or the boric, you can just simply say the child will be looking like old people or premature age or old looking. That will be the feature of marasmus. They will be having enlarged abdomen. You have seen the protein energy malnutrition, the marasmus child, they will be having that pot belliness, but necessarily it doesn't mean that they are healthy. And there will be dry flabby skin. So what we learned now in Sanic similar to that. And so this indicates actually marasmus. Then there is great emaciation, skin becomes shrivel or lies in abdomen, lies in folds. So same remedies, abrotanum, iodum, natrimnur, sanicula, same marasmus we are talking about. And there is rheumatism after mercury or after controlled gonorrhea. So gonorrhea leading to rheumatic complaints. And because it is a psychotic remedy, the pain will be aggravated in night and also damp weather. That is a common feature of psychotic remedies. Headache and periosteal pain, generally from mercury, syphilis, or suppressed gonorrhea. The most of the symptoms is actually in the urinary complaint. So they have the pain at conclusion of urination. Don't forget this symptom. So we actually, I had actually made something mnemonic to remember this one, that is best M. So medicines which are having dysuria at the end or the conclusion of urination, it will be best M. B for berberis, E for equisitum, S for sarsaparilla, T for thuja, and M for medorinum. Then there will be urolithiasis or the gravel or the colic. So the urine will be bloody, and this will be white sand in appearance, sarsaparilla. In case of Lycopodium berberis, we learned that it is a reddish in color, but in case over here, it will be white sand. The urine will be bright clear, so indicating it could be given for enuresis. Or scandy, slimy, flaky, sandy, copious, passed without sensation. Doesn't matter, even if you don't say all these things, doesn't matter. But do say, though the urine is bright and clear, it is still irritating. That is an important feature. We don't expect when the urine is bright, clear to be irritating, but here it is irritating and the deposit will be white sand. Then there will be painful distension and tenderness in bladder, urinary complaints. Dribbles while sitting, but when the patient stands, it passes freely. So this posture is also important. When the patient, if it is a female patient and if she is sitting to pass the urine, it is very difficult. It will pass only in drops. But if she is standing, then it passes freely. Child screams before and while passing the urine. And usually it is, this one is more important, excruciating pain or the renal colic from right kidney downwards, or right-sided colic, similar to lycopodium. So remember the pain at the end of the urination, the white sand, the particular attitude or the position the person takes in when they have that cystatic complaint, and the right kidney pain. Then the sexual system is affected. In case of male sexual system, their discharge will be very, very, very offensive, very intolerable stench. That's what they say. Intolerable stench on genital organs. Even the semen will be blood or bloody seminal emission. Fluid pollutions. I mean, the semen or the discharges coming from the male sexual system will be very much offensive and bloody in nature. And in female reproductive system, it is the retraction of the nipples, which indicates a cancerous condition. Nipples are small, withered, and unexcitable, like that of Silesia. Then another feature is about their skin. They have herpetic eruptions on all parts of their body. So they have all complaints after abuse of mercury, and hence mercury, it is an antidote also. Sarsaparilla and mercury, they have a antidotal relationship. They have rash from exposure to open air, dirty, dry and itch-like. This could be asked for a MCQ. Itching eruptions on forehead during menses, the same symptom that we learned in case of sanguinary. In sanguinary also we learned the same symptom during menses, and the one extra term was the scanty menses. Here it is not saying whether it is scanty or not, but during menses there will be itching eruptions on the forehead. Then as like in petroleum and graphitis, we have the ruggeds. Skin is cracked on hands and feet. Skin is hard, indurated, which indicates it would be a cancerous condition, especially of the breast. Pain and burning on sides of fingers and toes. So the main features will be renal colic, marasmus, periosteal pain due to venereal disease. So syphilis or gonorrhea ending up with rheumatism, especially of bones. Think about sarsaparilla. Yeah, this one is important. Eruptions following vaccinations. More than hot weather, it will be eruptions following vaccination. That is very important. Urinary symptoms. And urinary symptoms, all the symptoms we have told actually, the confusion of urine tribbles, child screaming before and during, right kidney pain. In male, the bloody emissions, intolerable stench, herpetic eruptions on genitals. Female, the nipples being small. And before menstruation, that particular itching eruptions. Skin emaciated, hanging loose like a folds of skin, and that indicating marasmus condition. Nadal, it is because it is a psychotic remedy, aggravation in dampness. Complementary merc, human antidote is mercurius. And sarsaparilla, I don't know whether you have heard this. Sarsaparilla is a blood purifier, and because this can be given for acne, this is Are we back?
Yes.
Yeah, so just two more slides. So this one I was saying, sarsaparilla is a blood purifier from the ancient times itself. So, and we also learned it is good for itching eruptions. So what I was saying was when we take for the homeopathic patents for the cosmetic, Bovista will be having eruptions after to applying all the makeup. And another medicine, if you go for that composition of the patent remedies, especially the another medicine that you can see will be sarsaparilla. So it is a blood purifier, and it is also restorative after overdosing with merc. That is why it is a homeopathic antidote to mercurius. And then with the same symptoms what we are saying, the urinary complaint, the passage of bowel, moist eruption before menses, even in males, offensive stench, urinary symptoms. Yeah, this another one that I told you for clearing the complexion. The saparilla is used, and the retraction or the flattening of the nipple, which means connected to the tumor. So even if the patient is not having any present tumor, but she is showing the symptoms of retracted nipple with a cancerous history, so saparilla is something to be thought of. Another one will be silesia, of course, but this is under remedy. And this will be the drug relations. That's all I think. So that's all for today. I hope you have taken the attendance. Have you? Have you sent me?
Yes, already.
Okay. So I'm saying you Friday class. I will let you know whether how the internet connection is going. If it is going like this, I will get mad. That you sitting at night and doing, and then internet going. So I will let you know on Friday how it is going, and then we do the class. Okay. So thank you for today. We'll meet on Friday, possibly, or on Monday, or on Monday for the tour. Okay. I'll let you know. We will be starting from here next Monday at 8:30 a.m. Okay.
Okay.
Okay, then. Thank you.
Thank you. Bye.
Thank you. Bye-bye.